you might be deficient in magnesium. The reality is over 50% of people are magnesium deficient. These are the 9 signs of magnesium deficiency you need to know about. So let's talk about it. Magnesium is a vital mineral. It's involved in over 80% of metabolic processes in the body. We get it, magnesium, you're important. So this video is really important for you to watch because I want you to get that message out to yourself, which you're doing by watching this video, but also to people you love, because if they have any of these signs and symptoms, they could be deficient in magnesium. But Dr. Clementine, I was tested for magnesium and it came back normal. Well, the standard magnesium blood test we do is not very accurate. Because magnesium is so important in the body, your body regulates it very closely, because if it's too high or too low, you could die. It has mechanisms in place to compensate for it where it's needed. So about 50 to 60% of magnesium is actually stored in your bones, and most of the rest of it is in soft tissues. So only about 1% of magnesium is actually in your blood serum. And the common test for magnesium tests it in your blood serum. The problem is when your body senses that magnesium is low in the blood, it will actually pull magnesium from the cells, from bones, places where you do want to have it to be healthy, but your body might pull it into the blood so it can be used for essential processes so you don't die. But what this means is that even if your blood serum magnesium comes back normal, that doesn't mean it actually is. It could be your body's way of compensating. So that test isn't very accurate, and that's been shown time and time again. There is another test that you could do, the RBC magnesium test, which is more accurate, but there's still some issues with it. That is why it is so important to be aware of these signs of magnesium deficiency so you can take action if you need to. So let me tell you really quickly why you desperately need it. In over 600 cellular reactions, from protein synthesis to energy metabolism, it's really key. It's needed for a healthy brain and a healthy heart because it's crucial in muscle and nerve function. It's crucial in regulating your blood sugar, your blood pressure, and deficiency in magnesium can contribute to a bunch of diseases or conditions like osteoporosis, hypertension or high blood pressure, heart disease. It can contribute to diabetes and even migraines. And we're going to talk about migraines and the link between magnesium deficiency and migraines because I know a lot of people suffer with migraines and they are brutal. Okay, let's jump into the 9 signs of magnesium deficiency that you need to know about. Number 1, fatigue and tiredness. If you're feeling tired all the time, you could be deficient in magnesium. There are a number of other things that can contribute, but this is one of the earliest signs of magnesium deficiency. And that's because magnesium is important in muscle function and energy production. So if you don't have proper muscle function, your muscles can fatigue easier and you end up feeling tired and like you don't have the energy to keep going. And energy production, right? So we need magnesium for ATP production. ATP is the energy that our cells need to function. So if we don't have magnesium, our cells are tired and so are we. If you're feeling tired and weak and it's not going away, make sure to think about magnesium as a potential cause. And there is also another reason magnesium can be making you feel tired, and that's number 2, insomnia. If you are struggling to fall asleep, it could be a magnesium deficiency. And that's because magnesium is involved in our sleep. It regulates certain neurotransmitters like GABA, and actually magnesium is involved in the parasympathetic nervous system. Now that might seem complicated, but just to break it down for you, there's the parasympathetic nervous system and the sympathetic nervous system. Sympathetic nervous system is the one that's activating. It's fight or flight. It's stimulating. It's what you need when you need to get into action. And then parasympathetic is equally important because it's what we think of as rest and digest. That's what we need for proper digestion, for proper sleep, relaxation, not having too much anxiety, not being too high strung. And magnesium is crucial for that parasympathetic part, that rest and digest. So if that's all out of whack and you're just overly activated, you might have trouble falling asleep. So I've seen a lot of patients who struggle with insomnia. It's one of the most common complaints, and I've had some success with my patients with a combination of magnesium supplements and melatonin to get a deep and more restful sleep. This is a natural, non-addictive way to help boost your sleep if you're struggling with insomnia. All right, moving right along to number 3, one of the most common and really annoying signs of magnesium deficiency, muscle cramps or muscle spasms, muscle twitching. Oh, I've suffered with this actually, so I can definitely relate to you if you have. But like I said, magnesium is important in muscle function, and specifically, magnesium is important in muscle relaxation. So if you're deficient in magnesium, your muscles will have a difficult time relaxing. Specifically in the lower legs, like in your calf, lower leg area, you can get those painful cramps sometimes that wake you up in the middle of the night. When I used to live in southern France, I was out a lot, I was really active, and I think I must have been deficient in magnesium or potassium because I was waking up with these brutal leg cramps. They were so painful, you know, if you've been through it. And I started supplementing with magnesium and potassium. This was before I was a doctor, so I just kind of like Googled it myself and figured it out, and it really helped. My muscle cramps went away in just like 2 weeks. For proper muscle function, you need both magnesium and calcium, along with a bunch of other stuff. But calcium actually helps your muscles contract, and magnesium helps your muscles relax. Both of these things are important. If you have proper calcium, but you have a low magnesium, your muscle is going to be contracted, but it's not going to be able to relax properly. That explains why you see leg cramps and muscle cramping with magnesium deficiency. Number 4, loss of appetite or decreased appetite. This can be accompanied with nausea, even vomiting. Again, this can be an early sign of magnesium deficiency. If you've noticed you haven't been really eating that much, you're not really feeling hungry, food's just not staying down very well, you might be feeling a bit more nauseous, it could be a magnesium deficiency. Now, this is what we call a non-specific sign, meaning it can be associated with a bunch of different deficiencies or conditions, but magnesium deficiency should definitely be on your radar if you're experiencing this, along with some of the other symptoms that I've mentioned. Number 5, constipation. So like I mentioned, magnesium is involved in digestion. In the parasympathetic nervous system, the rest and digest, so it helps bring water into the colon to soften the stool. If you don't have that because you have low magnesium, you're going to have a hard stool and you're going to have constipation and you're not going to like that. So that's why magnesium is so important for proper digestion. Magnesium can actually be used as a natural laxative because of this reason, because it helps treat constipation. Magnesium deficiency might be even more common in people who have GI disorders like Crohn's disease because they may have a difficult time absorbing magnesium from their GI system. So this could again contribute to some of their constipation and GI issues that they're experiencing. Number 6, numbness and tingling, that pins and needles feeling in your extremities. It's mainly in like your fingers and toes, and it feels kind of like that falling asleep sensation. That's because magnesium, like I said, is crucial for proper nerve function. So if you have low magnesium, your nerves are not going to be behaving properly, and you can get this pins and needles type sensation. Okay, so some of the next few that we'll talk about could be more concerning or more dangerous, so keep that in mind. That's one of the main reasons why you don't want to have a chronic magnesium deficiency. So number 7 is fast or abnormal heart rate. With a magnesium deficiency, you can get tachycardia, which is a fast, elevated heart rate, or you can get arrhythmias, abnormal heartbeat. You can get palpitations, skipped beats, different types of arrhythmias, and that's because your heart is a muscle. And magnesium is needed for proper muscle function. So early on, you might see leg cramps because of magnesium deficiency, but you could also see a more concerning sign, which is these heart issues. So just to mention, some skipped beats and palpitations can be normal. They can be caused by anxiety or just different lifestyle things. Just also some skipped beats are just normal to have. But if you're having them constantly, if they're new onset and they're not going away and they're just getting worse, it could be related to a magnesium deficiency, and you definitely don't want to ignore that. Number 8, high blood pressure. So we talked about magnesium being extremely important in muscle relaxation. Well, your blood vessels have smooth muscle in them. So if you're low in magnesium, you're going to have a hard time relaxing that muscle in your blood vessels, which could contribute to high blood pressure. If you've noticed your blood pressure has gone up and your doctor has ruled out other causes, consider a magnesium deficiency. Number 9, mental health issues like anxiety, depression, difficulty coping with stress. A lot of people ignore this link between diet and magnesium deficiency and mental health issues, but it is a real one because low magnesium is thought to be linked with low neurotransmitters like serotonin and dopamine, and those are the feel-good neurotransmitters that are involved in anxiety and depression, which then can contribute to, not the vibe, which then can contribute to lower levels. Oh my gosh, why? Which then can contribute to lower levels of serotonin. And magnesium is also involved in regulating NMDA receptors. Now, it's a bit complicated. I'm not going to get into all of it, but it basically helps prevent overstimulation and overactivation of this pathway. And that could be contributing to higher levels of anxiety. So if you don't have magnesium and you're deficient in it, these pathways could be overstimulated, which could contribute to anxiety, depression, and difficulty coping with stress. And there's another reason why you might have difficulty coping with stress if you're low in magnesium, especially if you've noticed this new onset of it, where nothing else has really majorly changed, but you're just struggling. You're way more stressed out. You're just having a tough time coping with a lot of things in your life. It's because magnesium can reduce cortisol levels. And cortisol is the stress hormone. So if you have a lot of cortisol and it's unregulated and it's at the wrong times, that could contribute to more stress and difficulty in coping with stress. Chronic magnesium deficiency has even been known to cause personality changes in people. Let's talk about some of the conditions magnesium deficiency can contribute to or cause, because some of them are quite serious. One of the major ones is osteoporosis and osteopenia. So that's brittle bones with low bone density. Basically have a breakdown of bone tissue and the bone becomes honeycomb-like. And so you could be at risk of falls, of fractures. Magnesium, calcium, and vitamin D are very important. They're like best friends when it comes to your bones. They all work together. They're all needed for proper, healthy bone health. Osteopenia is just kind of like an earlier, less severe form of osteoporosis, kind of before it turns into osteoporosis. So you definitely want to make sure you're getting adequate levels of magnesium to maintain healthy bones. Like I mentioned, 50 to 60% of the magnesium is stored in your bones, so you need that magnesium there. And if you want to know about vitamin D deficiency, which is extremely common, check out my other video I recently did on it, on the key signs of vitamin D deficiency and why you need to supplement with vitamin D. I'll link it below, but definitely check that out. So next is heart disease. So we talked about how magnesium can cause irregular heartbeat, increased heart rate, and research has shown that low magnesium levels in the blood can contribute to cardiovascular disease. Observational studies have shown an association between low magnesium levels and things like atherosclerosis, coronary artery disease, heart failure, arrhythmias. So this is serious stuff. Proper magnesium levels can also help manage your blood sugar. And low levels of magnesium have been associated with insulin resistance, for example, in diabetes. It's not that low magnesium will cause diabetes, but it does seem that having proper magnesium levels can help you control your blood sugar and help prevent that insulin resistance. Low magnesium levels are actually quite common in people who do have diabetes. Okay, and I want you to know about migraines and magnesium deficiency, because a lot of people suffer with migraines and they are brutal. Some studies seem to show that magnesium supplementation could actually decrease the frequency of migraines by about 40%. It's not really clear what the role of magnesium is in migraines, but it could be that it's related to blood vessel relaxation. It could help the blood vessels that are going to your brain relax, get more blood flow there. That could be one potential mechanism, but findings have shown that people who are deficient in magnesium or people who supplement with magnesium, it could help with their migraines. And like I mentioned, magnesium deficiency is also linked with high stress, anxiety, depression, all of which can be triggers for migraines. So controlling some of those triggers can also help decrease your migraines. All right, so we are done today's video. Make sure to subscribe and give this video a thumbs up so that I know that you found this video helpful. And subscribe or leave me a comment below if you want me to do a video on the best foods to eat to help prevent and treat magnesium deficiency, as well as what form of magnesium would be best for supplementation, because there is a difference in how they're absorbed. Let me know down below if you want to see those videos, and thank you so much for watching. We're on a goal here to become the best and healthiest versions of ourselves. So join me and let's do it together.